All right, welcome to ID Talk, Answers from an Infectious Diseases Expert. I'm Dr. Sean Elliott, a pediatric infectious disease specialist with Tucson Medical Center, Professor Emeritus of Pediatrics at the University of Arizona College of Medicine, and Medical Director of Infectious Diseases and Immunizations at the Arizona chapter of the American Academy of Pediatrics. This podcast has been created to answer questions from our chapter's members about the COVID-19 pandemic. Today, we are very fortunate in having a special guest to welcome Ms. Jessica Rigler, who is the Assistant Director of Public Health Preparedness and leads the Division of Public Health Preparedness for the Arizona Department of Health Services. Jessica joined ADHS in 2008 and has been in her current role since 2018, just in time to prepare for the COVID-19 response. And she, as you can imagine, is thick in the middle of the state's response to COVID-19 preparedness, vaccination outreach, you name it. So we are truly fortunate to bring Jessica to the podcast today. I'm going to start off with the hot topic of the day, and that is COVID-19 vaccinations 5 through 11. How are we doing with vaccine rollout? What about sustainability? What's our status?
Yeah, thank you so much, Dr. Elliott, for having me and for that great first question. It's one of our highest priorities right now is ensuring that we're able to get these kids vaccinated now that thankfully the vaccine has been approved for kids 5 to 11. We've got over 900 providers across the state who have onboarded and said that they are willing to vaccinate pediatric populations. It's not quite up to that number yet of those who are doing it currently, although anyone who's onboarded can order pediatric vaccine through ACES. And start administering. We've got almost 200 pharmacies too that are doing pediatric vaccinations around the state. So every county is covered with multiple providers that can provide vaccinations to our pediatric populations. In Arizona, we've got about 645,000 kids between the ages of 5 to 11. Of course, we want all of them to be vaccinated. Polls show maybe 30% or so of parents are eager to immediately get their children vaccinated. But we're going to continue to do messaging to push information out and try to answer as many questions as possible, and also urge parents to talk to their pediatricians or family practice docs if they've got specific questions for their kids.
Oh, that's great and very encouraging. Asking for a friend if a practice didn't initially get set up to receive vaccine shipments, can they still do so? What's the best mechanism to get themselves up and running to give vaccine?
Yes, we would love to welcome new providers to the COVID-19 vaccination program. They can outreach through our immunizations program and start the onboarding paperwork. It's available on our website. It does require submission of information similar to the Vaccines for Children's program. So you have to submit temperature logs and pictures of your storage units and all of those sorts of things in order to be compliant, since we're utilizing federal vaccine right now. But absolutely at any time, if anyone is interested in signing up to onboard and be part of the COVID-19 program, we are very happily taking on new providers every day.
Oh, fantastic. Okay, great. Thank you. Let's sort of broaden it a little bit to encompass your huge role with ADHS. What's happening at Public Health Preparedness Division? What's happening behind the scenes? What are your hot topics?
Yeah, we have hundreds of people at the department who have been working on this response since January of 2020. I looked at our time log the other day, over 250,000 hours put in by the staff here on this particular response. And that's nothing compared to all of our local public health practitioners at the counties and the tribes and all of our frontline healthcare workers and things too. So a huge shout out to everyone who's really doing their best to contain this pandemic. Our division is broken up into 5 bureaus and they all have some role to play in pandemic response. We've got our public health emergency preparedness group, and they really work on all the planning to prepare the state for responding to a bioterrorism event or an infectious disease outbreak or natural disaster. And they usually run our logistics section. And so they've been busy throughout this acquiring PPE and distributing over 70 million pieces of PPE throughout Arizona to providers and things. And we've got our statistical group that does all of our data analysis and statistics, and our informatics group that's running the dashboard and all the behind the scenes ins and outs of that dashboard. Our state laboratory also is part of the division, and they continue to conduct testing for COVID-19, particularly for outbreak situations in congregate care settings, but other special circumstances as well. And then they're also the group that helps with any questions on CLIA licensure, like, is this test actually FDA approved and can I use it? And what if this test is, not approved, what should I do? Our epi and disease control group is a huge component of all of this, right? They do case investigation and contact tracing, all the technical assistance for local public health. They're the ones that are combing through the latest research and guidance in order to issue Arizona specific guidance for a whole variety of settings. And our immunizations program falls within that area as well. And then our division has the Bureau of EMS and Trauma Systems, and pre-hospital care is a huge component of this response as well, ensuring we have a strong ambulance service and enough registered emergency medical care technicians to be able to respond as well. And then our statistics group, as I mentioned, is doing a whole lot of data analysis on the back end to see if we can identify trends.
Oh, sure. Wow. So an incredibly robust, department with fabulous divisions. As you're talking about those, I'm of course having a little PTSD from the Ebola days from West Africa, and I know that was a unexpected start to sort of jumpstart in the process. How much have you had to escalate your services in terms of recruitment, outreach? I imagine it's been huge.
This is a group that is used to responding on the fly to infectious disease cases and outbreaks. So I remember a call. I was actually in Los Angeles on a Saturday when our first case was diagnosed in Arizona, and on a call with the whole group convening, we had stood up our health emergency operations center that Sunday, and we're ready for, a measles type response, or maybe like Ebola where we had stood up, but it wasn't quite so robust. But we've spun up quite a bit over this time, and we've added whole new functions. For example, typically case investigation, contact tracing is the domain of local public health. But because of the sheer volume, we needed to make sure we could support those partners. And so we've stood up contact tracing team that at one point was 600 people large. That was all brand new contracts that we brought on. We also, because of the scale of the vaccination services, stood up vaccination sites around the state in partnership with phenomenal partners at the universities and our medical practices and all kinds of partners across the state in order to get people vaccinated, which was something we had never done before either. We drastically expanded our lab capacity, which our lab's used to doing for things like Ebola and Zika. They are typically one of the first in the nation to bring on new assays, and they did the same here for COVID. We stood up the Arizona Surge Line, which was also a brand new service in order to load level hospitals so that we didn't get into a situation like we saw with New York early on. So now we have a whole service that operates a transfer center for hospitals in Arizona. It's really just been a tremendous amount of growth, and I'm constantly thankful to our team for being so flexible and resilient through this time.
Oh, that's fantastic. And yeah, greatly appreciate it. I know as we all try and get through this one day at a time. So sort of moving into a little bit in terms of the outreach component of the department, it's obviously important to stay up to date on information in timely fashion. What steps has ADHS been taking just to, I guess, keep healthcare workers up to date, empowered, educated, et cetera?
We try to push out as much information as possible, but also recognize that only does so much, right? If you don't follow us on Twitter or on Facebook or something, you're not going to get all the information we push out through social media. And we acknowledge, some of the shortcomings of that, although would encourage you to follow us on Twitter and Facebook and other sources as well. We routinely publish information and blogs and press releases too. And those are areas that anyone is encouraged to subscribe to. Specifically for healthcare workers, we try some additional avenues to make sure that we can get information out. For example, we maintain the Health Alert Network here in Arizona, and that's a subscription service specific for healthcare providers where we're sending out additional infectious disease information or information about new therapeutics or recalls or anything that may be helpful that way at HAN, that's HAN, HAN.health.azdhs.gov. People can register to receive those health alerts. And as I mentioned, those are specific to clinicians. And we also have a couple of different phone apps too. IDAZ is one of them. And that's an app that we maintain where we update infectious disease information specifically for the state and push out guidance documentation.
Oh, that's great. I must say, in case anybody's worried about being overburdened with information, that's not true. I participate in several of the outlets that you mentioned, including the HAN. And the notices I get are very timely and very appreciated. So, but not a every sort of hour sort of thing happens. So, yeah, right, exactly. There's a lot to get out there. The other part, of course, of outreach and communication is to the general public. How has ADHS found that process? Has what barriers, what opportunities are out there?
We're very thankful to our media partners. We get a lot of earned media in the department related to this outbreak. So not a day goes by where we're not requesting to or having a request to be interviewed by a media outlet. And so we really have tried to take advantage of that to get information out to the public in addition to organized press conferences and our social media accounts. We also post press releases and blogs to get information out. But a lot of times, especially when you think about, vaccine hesitant populations or other groups, that kind of mainstream messaging isn't the best way to reach them. And so we've tried to leverage additional partnerships in order to get more targeted messaging out. We've done some really micro-targeted campaigns in specific zip codes, for example, that had lower vaccine coverage, and did teletown halls with those groups. Like we do robocalls to a specific zip code and have people call in to ask questions. And so we've tried some really targeted outreach that way. And then we've contracted with community-based organizations too to reach specific populations, knowing that government really isn't the answer for information for everything.
With that in mind, how has been the uptake of those targeted populations with that specific messaging?
When we've done the micro-targeting for those specific zip codes, we actually have seen an increase in vaccination coverage shortly following those outreach efforts. So we felt really good about that. In the early days, we were actually doing direct connections between residents in those zip codes and vaccination sites where we were coordinating transportation, making vaccine appointments, like the whole way through, not just information, but helping people access the sites as well. And that resulted in several hundred additional people getting vaccinated. But we continue to monitor percent vaccination increase in these communities we're targeting, and are seeing successes in those smaller zip code areas with incremental increases in vaccination coverage.
Wow, that is truly fantastic. And putting my cynicism aside, that's a little bit unexpected, but very good to hear.
Yeah, it's, every population is different. And so that's where we're really trying to work with community partners on the ground. And one of our messages continues to be talk to your doctor. We really want people to be accessing their trusted healthcare provider, because we know those one-on-one conversations are, a lot better at getting information out than a billboard or a PSA.
Oh, yeah, absolutely. And to that point, so talking about community partners, obviously a lot of people will be listening to the podcast. What can we do to help the process? How have healthcare providers already been participating in the process?
There's several areas. One is just, talking to your patients, asking the simple question on, have you been vaccinated, or do you have any questions about COVID or the COVID vaccine, is one way to just start that conversation. We also have healthcare clinicians that are working with community-based organizations to do outreach. So sometimes we have vaccine providers that are on contract, or local public health has vaccine providers on contract, and they've got nurses and other staff that are out there giving shots, but they'll bring in community physicians to help just answer questions. So they're not necessarily there to vaccinate, but they're there to at community events to answer questions for people who may have very specific questions. So that's one way to get involved, is through local public health and identifying whether there's opportunities to just be the expert in the room for specific events.
That's great. So if one of our chapter members or somebody listening wished to volunteer or to be part of that process, what's the best way for them to reach out and get their name on the list?
I think there's probably a couple ways. One is through their local county health department. ADHS can also take that information in, vaccines@azadhs.gov. If you email us through that link, we can field that through our health equity team to get connections. And then there are organizations out there like TAPI, the Arizona Partnership for Immunizations, that has also been trying to source volunteers for subject matter experts to do education in specific communities.
Okay, great. Thank you. So you've touched on this already, but sort of the big question is, how can we best prepare our patients, families, community for what we assume is an ongoing pandemic?
Well, I think that's one of the most important pieces, is helping people understand this is an ongoing pandemic. I think everyone's waiting for, us to flip the switch and there's no more COVID anymore. And I think the reality is it's going to look a lot more like influenza. It'll become endemic across the world. And so that's where we just need to help people understand the best things they can do to protect themselves. And so it's really having those conversations. Vaccines have been with us for decades and decades and decades. The idea of a vaccine to prevent disease outbreaks is not new. And so that's one way to help protect people and make sure that they're not suffering serious consequences from the disease. Continuing to really level set expectations with patients and the public is going to be very important, so they understand that we're not in an all or nothing approach. They really need to think about how they can be healthy in their everyday lives. And that's messaging that we do often, right? Stay home when you're sick. Get vaccinated if there's a vaccine for the disease you're trying to prevent. Cover your cough, wash your hands. The simple messaging that we give for other things works for COVID too.
Yeah, keep it simple, sweetheart. It's like, that is the best way to do this. Obviously, there's a lot of common sense inherent in that response. Are there additional training resources that ADHS has, or that you'd like to broadcast to our chapter's members?
As far as training goes, we've got, we have a ton of resources on our website, and it can be really hard to cull through all of that because it's not always easy to find exactly what you're looking for. On our main COVID page, we've got a communications page. And if you click on communications, you can see all kinds of materials. So if you're looking for posters for your office, that's a good source of information, or videos to play in the waiting room. That's another good source of information. We also promote CDC's COCA trainings, which are those clinical trainings that have a lot of really good, deep clinical information. We've got a specific healthcare provider page on our COVID-19 website too, and that has more in-depth information for things like monoclonal antibodies, for example. So if you're interested in administering monoclonal antibodies or want more information about how to help your patients find treatment, that information is on our website too, and we'll expand it soon when antivirals are approved by the FDA, so that we can get information out about antivirals too. So really our website is the best source to go for that kind of information, and specifically the healthcare provider section of our website will have a lot of more detailed clinical information. Great.
Wow. Thank you. So just two more questions. One you're expecting, one you're not. Sorry, I have to throw a little ringer in there, just a little bit. The one you're not expecting is what I get asked almost every day. What does the future of the pandemic look like? And there are several models out there, like big surge, little surge, big surge, little surge, or sort of dull roars and eventually endemicity. Any thoughts, input from ADHS about that?
Early on, when we were making lots of resource requests to FEMA, I put in my resource request for a crystal ball, and they have never supplied it. They've given us lots of other things, but not the crystal ball. Yeah. So I wish I knew for sure, but just as a matter of prediction, I think we'll probably see sort of this low underlying baseline level of COVID after we stabilize, and then peaks. I don't know if those peaks will mirror flu, where we get just like a winter peak of COVID every year, or if we'll see low levels and then, just random seasonal peaks, maybe like norovirus, summertime peaks or something. But that's really what I would anticipate. And they could align more with school coming back in session and with the holiday gatherings, times when people who aren't usually around each other are coming together.
So it's not ending tomorrow, in other words?
No, I wish it were. I think our hospitals are pretty constrained right now for COVID and other cases, and we're still in surge 3 at this time, I think. So yeah,
definitely. I think many of our experiences numbers are still increasing, and including in peds. So okay. So you've got a whole bunch of healthcare providers listening to this. Any messages for them as we sort of close this session?
I mean, the biggest thing I have to say to all the healthcare providers listening is thank you. Everyone has worked tirelessly, and I don't think we can say thank you enough for just being out there on the front lines, being the people that are interacting with patients every single day and helping them through fielding the questions and the anger that sometimes comes related to COVID or recommendations that we're giving from an evidence-based perspective. So honestly, I really think the answer to a lot of this is those individual level conversations, and it's you all on the front line that are having those with the patients that are making an impact every single day on the lives of Arizonans. So just gratitude and appreciation, really.
Oh, thanks. And honestly, I'd like to extend our huge appreciation to you for everything you do, slogging out at the state level and getting it to go down to the ground. So thank you so much. Yeah. So folks, that is Jessica Rigler, the Assistant Director for Public Health Preparedness, and I would say, quite honestly, one of the key figure in our COVID-19 response in Arizona. Thank you all for listening to ID Talk. AzAAP members can submit questions for future episodes to covid@azaap.org. AzAAP would like to acknowledge the generous support of this podcast by the Arizona Department of Health Services through the Title V Maternal and Child Health Services Block Grant funding. For more information and resources related to COVID-19 in Arizona, or to learn how to become a member, please visit us at azaap.org. Meanwhile, hang in there, keep fighting the good fight, and thanks again to Jessica Regler for doing all that she does. Thanks, everyone.